I was doing my rotations as a first-year resident. I have the opportunity to rotate with a nephrologist. I was able to see how are the patients like in the clinic when they have early stage chronic kidney disease. I was also able to see the patients in the hospital when sometimes they progress to a point that they will need dialysis. When I start my fellowship in general nephrology, I was exposed to all those transplant patients when they finally get rid of dialysis because they got a new kidney and they were able to gain back like the autonomy and feeling like their own self again. So seeing that evolution of the patient was the reason that made me also do the specialty in transplant, because I am able basically to see the whole evolution of the patient when they have chronic kidney disease. First visit, we establish what is like your baseline, what is that you have right now. And we start discussing the methods to prevent the progression of kidney disease, if we are like adjusting medication, if we need to adjust the diet, if we need to increase like the fluid intake. We discuss all those aspects. Also, if we need to be like more aggressive on the blood pressure management, we discuss all those methods in the first visit, and then we start working on that. On the next visit, we evaluate how is the patient responding. If the patient is not responding to what we did in the initial visit, then we try to optimize the treatment, making sure that the patient gets everything that it needs to prevent the progression of kidney disease. Chronic kidney disease could be scary for a lot of patients, and it's actually a very common condition. Sometimes we are not aware that we have kidney disease until we do like a blood work, and then we said, oh, hey, I need to see a kidney doctor. There are new medications that are also available that could help depending on the type of kidney disease that you have. There are also more research that is going on also with new medications to help with the patient with kidney disease. When the patients just say, oh, thank you for everything that you have done for me, when I see that there is a stabilization in the renal function, some patients I can see an improvement on the renal function. So that's very rewarding, seeing that I am doing a good impact on the patient health. And also when the patients say like, hey, I am going to start doing this, like more exercise, drinking more water, I am starting to eat more healthy, that means that I am doing an impact on the patient.